Dr. Nancy Georgekutty discussing GERD as well as allergic rhinitis. And the number to the studio is 972-235-5555 to be part of the conversation and call our experts anytime during this show. During the break, we actually had a couple of questions. One was through our Facebook Live page from Sanjay, and his question was on apple cider, and wanted to have Dr. Georgekutty to elaborate more on this, as well as some other home remedies. And the second question was from Pushpa. Actually, let's go ahead and address Sanjay's question first. But before we do that, can we go back to the question from our other caller that happened before the break?
Sure. This is Dr. Amin, and just to paraphrase the question, our last caller had a question about some umbilical or pain around her umbilicus and what that could be, and if it could be reflux. Umbilical pain can be a lot of things, and sure, reflux could be one of the things that is the cause of it, but it could be many other things. So really our recommendation would be to probably go see your primary care physician to make sure nothing more serious is going on.
Okay, let's get back to Sanjay's question on the apple cider and other home remedies for GERD.
So that's a great question, and a lot of people want to know about apple cider vinegar and home remedies for acid reflux. Normally I would tell my patients apple cider vinegar, you can use it as 1 tablespoon in about 8 to 10 ounces of water. And that'll usually help to kind of neutralize the acid inside the stomach and actually settle your stomach down. Some home remedies we might tell people to use that's just at home and helps with acid reflux or heartburn is yogurt, which is great, plain yogurt of course, and milk. That's something most people will have, considering you're not lactose intolerant. And so that's something you would want to have, you can use as a home remedy.
Let's address another question from our caller, Pushpa, who was having cough for the past 2 months, and she wanted to know if this is something serious or something this would mimic like a GERD symptoms.
This is Dr. Amin, and that's a good question. So cough for 2 months, which is pretty long-standing cough, can be from many things, and sure, reflux could be one of the things that can cause it, but so could allergies. If you're a smoker, that's a worrisome a symptom. If you've been exposed to someone who's had a cough, it could mean an infectious disease process. So really, for that kind of thing, you really should see your primary care physician to make sure that it is reflux and not something else going on.
Folks who are joining us, you're listening to Doc Talk Live, and we have Dr. Amin and Dr. Georgekutty discussing GERD as well as allergic rhinitis, and the number to the studio is 972-235-5555. So let's switch gears and let's talk about allergic rhinitis. Dr. Georgekutty, could you please discuss what allergic rhinitis is and what are its common symptoms?
So this is Dr. Georgekutty. So allergic rhinitis is very common, especially here in Texas. So it's a group of symptoms which affects the nose when you breathe in something you're allergic to, like dust, animal dander, pollen, or certain foods. So symptoms of allergic rhinitis, which I'm sure a lot of people are experiencing right now because this is mountain cedar season in Texas, runny nose, itchy eyes, sneezing, stuffy nose. So those are kind of the symptoms that you look for in allergic rhinitis.
Why don't we take one of our callers? Hi, you're live on Doc Talk Live. What's your question for our expert? Go ahead. Looks like we lost her. So the number to the studio is 972-235-5555. Again, 972-235-5555. Back to our discussion on allergic rhinitis. Dr. Amin, what are some non-prescription and prescription treatments for allergic rhinitis?
Okay. So the thing you want to do is you want to avoid triggers. So that's hard to do, especially because we all go outside. So, other than just avoiding going outside, the things you want to do is stay inside during high pollen days. So if you know you have a mountain cedar allergy, then this time of the year may not be the best time to go on a hike or a picnic or something like that. The other thing you can do is, one of the symptoms is itchy eyes. So when you are outside, wear sunglasses so the pollen doesn't get into your eyes. Or, don't rub your eyes so much. So those are some of the things you can do. When you're indoors, you want to keep your windows closed so the pollen doesn't get into the house. You want to limit your exposure to dust mites. So, things you can do is mite-proof pillows and comforters, and then also dehumidifiers also help.
Great. Let's go after some of these callers. Hi, you're on Doc Talk Live. What's your question for expert? I'm sorry to hear that. You must be very frustrated. Dr. Amin or Dr. Georgekutty, any comment on that?
Hi, this is Dr. Georgekutty. So it's interesting that you have the symptoms of like a 30-pound weight loss over the past year after your endoscopy. So it could be that your diet has dramatically changed and you're not taking in as much calories as you were taking in previously, and that's why you've lost the weight over the 1 year mark, considering they haven't found that your physician hasn't found any other source for why you've actually lost the weight. The other thing you could do, you were asking a second question about how you can gain your weight back. You can try protein shakes to try to gain your weight back. Eating foods that are not going to stimulate the acid reflux like we talked about earlier, like citrus foods or spicy foods. But you can do protein shakes, which will actually help you to gain weight, and maybe increasing your carbohydrates and monitoring your calories. There's a lot of apps on your phone that you can follow to help you increase your calorie intake on a daily basis.
Let's take our next caller. Hi, you're live on Doc Talk Live. What's your question for expert? I'll refer you to the Funasia website, and after 6 o'clock, please call in for that. Let's take our next question. You're live on Doc Talk Live. What's your question for expert? Mm-hmm. Yeah. Yeah. So I guess I have another thing in common with you. I moved from San Diego too, and I went through some of those symptoms. So maybe you guys, Dr. Cuddy, you can explain, or Dr. Amin, what's been going on.
So I'm Dr. Georgekutty. I actually moved from New York 8 years ago to Texas, and I just started to experience mountain and cedar allergy as well. So I can totally empathize with you. So unfortunately, when you live in different states, you have different allergies. There's different pollen in the air. There's different trees. There's different flowers. So when you live in a certain place over a period of time, our body starts to develop an allergy due to the exposure. Just like Dr. Amin mentioned, when you're exposed to different pollens, you start to develop the symptoms. If your symptoms are becoming more daily and is worsening, you can talk to your primary care doctor, and they can always prescribe you medications to help you. It is unfortunate that when you have allergies that become very severe, sometimes asthma can come about from that. And that's something you'll have to talk to your primary care doctor about, and they can help you, give you good advice and give you prescriptive medications for that.
We just got a question from our Facebook Live website. Can GERD be fatal? If you don't do anything about it?
Sure. This is Dr. Amin, and that's actually a great question. So treated, most people do really well with GERD. Untreated, that's where the complications can arise. So complications include esophagitis, which is inflammation of the esophagus, narrowing of the esophagus, and ulcers. But really the one concern concerning factor we have is that chronic GERD can cause permanent changes in our cells and can lead to something that we call Barrett's esophagus, which is a precursor for esophageal cancer. So, a great question.
Great question on Facebook Live. Let's take our next caller. Hi, you're live on Doc Talk Live. Great question. Thank you for calling, Dr. Amin.
So yeah, again, that's a great question. And this is Dr. Amin. So it sounds like you're describing some indoor symptoms. So you may want to see if you have an allergy to dust mites, because that is not uncommon, especially people that say they have their symptoms while first thing in the morning at night. So dust mites are everywhere, and so unfortunately we can't completely avoid them, but there are things you can do to limit the exposure to them, and I alluded to that earlier, including mite-proof pillowcases, mite-proof comforters, using a dehumidifier in your room. Those are things that can help those symptoms.
Dr. Cuddy, you want to add anything to that?
Another great way of helping the allergies within your household is getting an air purifier, and that's something that's widely sold on different websites and stores. So an air purifier actually helps to kind of get rid of a lot of those allergens.
Great question, guys. Let's take another caller. Can you turn the radio off in the back? You're on Doc Talk Live. What's your question? Uh-huh. Mm-hmm. Okay. Uh-huh. Great question. I know a lot of our listeners are going through some of the things that you are. We only have a minute left, so we'll try to, I think this is a good time to just go over treatment of this condition. And for those who we don't get to today, log on to our website, Doc Talk Live, and put your question in there, and we'll answer it, okay? Dr. Amin?
Okay, so some treatment options are antihistamines, intranasal steroids, corticosteroids, as well as leukotriene inhibitors, which are all medicines that work to avoid histamine release. Our caller asked about non-medical treatment options. Getting local honey is a good treatment, because what that does is the bees produce the honey, but they're from the local, they feed on local flowers, so you get some protection from local pollen on that. The other thing is, unfortunately in Texas and in Dallas, allergies are just not treatable, and you may want to consider allergy shots, and we do those when treatment is ineffective.
And we don't want our last caller to leave Dallas, so
yes, absolutely not.
And we're ending our show, and I'm sorry we didn't get to all the questions. Again, log on to our website, doctalklive.com, and enter your question there, and we will be back next week. Stay healthy, Dallas, and we'll see you next Monday.